Hello, my group will be presenting on the topic speech sound disorders, articulation and phonological disorders. My group members are Atika Waida binti Zainuddin, Fatin Syami binti Kamaruddin, Redza Nur Jasmine binti Zainal, and lastly Siti Khadijah binti Mama. The aim of this project is to conduct a research and investigate and gain information about speech disorder. The main focus will be the articulation and phonological disorders. These are two types of speech disorders, and the main objective is to spread awareness on speech disorders to our classmates and actually to everyone. The methods that we have chosen are books and website, and we did pay a visit to otorhinolaryngology department at the University Malaya Medical Center, and we had a nice interview, even though it was short, with Dr. Baljit Kaur, and she is a specialist on the speech audiologies and pathologies. This is the picture of us at the outside of the clinic. Okay, what is speech disorders? Okay, so a speech disorder is defined when a person is unable to produce speech sounds correctly or fluently, or has problem with his or her voice, by the American Speech Language Sound Association, or ASHA. Okay, for example, the difficulties pronouncing sounds or articulation disorders and stuttering.
There are three possible factors affecting speech disorder. The first one is speech and hearing mechanism. For hearing loss, those persons who experience severe hearing loss, they will have difficulty in decoding the incoming sound signal and will perceive words differently. It will also affect their speech perception and production. For influence on speech, the deaf speakers are using excessive jaw movement to establish different vowel shape instead of appropriate tongue movement. This is based on time array. Next, the second factor is the cognitive linguistic. By determining the type of instructional or intervention program that may be efficacious for the children's overall language development, it shows that the child is having speech disorder. Knowing this factor will provide better understanding of interrelationships of various components of language behavior. The last possible factor is the psychosocial factor, which it involves the age, gender, family history, and socioeconomic status of the child who having speech disorder. For age, at 8 years old, children's articulatory and phonologic skill will improve, and for normal children, they acquire most aspects of the adult sound system. For gender, there is a comparison of phoneme acquisition between males and females, and also a comparison of the incidence of the phonological disorder in males and females. Next, for family history, according to Matheny and Brueggemann, the genetic factors may relate to phonologic disorders. Additionally, John and Nicholas said that families of disordered children reported to be significantly more members with speech and language disorders. The fourth factor is the socioeconomic status. In parental occupation aspect, at 4 years old, it becomes a factor in children's articulation skill, while at 8 years old, there will be no influential in children's articulation development. Lastly, according to Weaver, children has more articulation errors were from lower occupational group rather than upper occupational group.
Assessment. There are two most commonly used assessments, which are screening and comprehensive assessment. So the first assessment is screening. Screening is actually a gathering information from the parents and teachers regarding concerns about the child languages and skills in each language. Second is managing formal screening assessments and demonstrated evidence of sufficient sensitivity. Screening of spoken language skills is conducted if a language disorder is suspected, and screening does not result in a diagnosis but rather indicates the potential need for further assessment. So the second assessment is the comprehensive assessment. Individuals suspected of having a language impairment based on screening result are referred for a comprehensive, linguistically appropriate assessment by a speech language pathologist and other professionals as needed. So comprehensive assessments are involving hearing screening, oral mechanism examination, spoken language testing, involving phonology, morphology, syntax, and other several fields. The result of assessment is actually a diagnosis of a spoken language disorder, which are the receptive language disorder, expressive language disorder, or expressive receptive mix. The assessment is also the determination of a language delay in the absence of a language disorder, which might be the language disorder is caused by language delay due to environment environmental influences, description of the characteristics and severity of the disorder or delay, identification of literacy problems, diagnosis of a speech sound disorder, identification of possible hearing problems, recommendation for intervention and support, referral to other professionals as needed.
There will be two types of treatments that we will be focusing on. The first is traditional production trainings that involve 4 steps. The first step is isolation, where the patient will be taught on how to produce a target sound in isolation, where the doctors will focus on only one target sound. And the second is nonsense syllable, where the patient will be taught on how to produce a sound in a syllable. And then the third step is words, where the patient will be helped on producing a sound in a meaningful units, which are words. And the fourth step is called syntactic utterance, where the patient will be taught on how to produce the target sound in a longer sentences and phrases. The second treatment is called distinctive feature approaches. It is usually used when a patient have trouble in pronouncing sounds that may sound identical to them. For example, the minimal pair sound like t, k, p, b, and k, g. This treatment also involves 4 steps. The first is discussion of words, where the doctor have to determine whether the patient know the meaning of the words that will be used in this treatment. For example, for the sound t and k, and the doctor want to use the word t and ki, they have to make sure that the patient know the meaning of those words. And the second step is called discrimination testing and training, where the patient is tested whether they can identify the feature sound that contrast with each other. The third step is called production training, where the patient has to demonstrate whether they truly can identify the contrast of the sound. For example, they must be able to produce the correct sound when the therapist point at the suitable picture card. And then the last step is called carry-over training, where once they're able to pronounce the target word, the patient will be assisted in using the word that contain the target sounds in a longer and more complex sentences and in conversations. There is an additional treatment where parents can do at home, where they spend 5 to 10 minutes times per day training the child to produce the sounds that they cannot pronounce correctly. The instruction will be given by the doctors via papers or link to the suitable websites.
So basically, to conclude, speech disorders can affect anyone, literally everyone, but most patients are among children, since speech disorders usually detect from when a person is still a child. Children of 9 years old and below are easier to treat than the older ones. These are because they tend to make fewer mistakes than the ones that are in the teenage years and the adult life. And the duration of treatment depends on the child's ability to imitate the target sound. So every child has a different treatment and different period of time to recover, to face the recovery period. Lastly, the seeking treatment for speech disorder is important so that a person can have a normal phonological and articulation ability, confidence while having an interaction, and to avoid communication difficulties. Thank you.